Have you ever had one of those shifts that you work and you come home and you are just done? Not a little tired, but the kind of done when you drive home and then sit in your driveway for an extra 10 minutes and just stare at nothing. I do think that most nurses know that feeling. And when you're in it, every other job just looks incredible. Everything besides what you're doing. You might think about, remote nursing jobs, they might look incredible. Or if you're hospital, maybe switching to outpatient, that might look incredible. You might fantasize about different, roles like maybe, transitioning to PACU or just some other type of unit. If you're a nurse, you might be dreaming about going back to school to maybe getting your nurse practitioner degree. Just everything else looks better than what you're doing right now. And I want to tell you something just a little bit kind of embarrassing, somewhat funny. There was actually a stretch where I, as an ICU nurse and nurse practitioner, actually really seriously considered starting a t-shirt business. I actually took out the LLC and everything. I had an entire Etsy store built up. I actually do love designing things, so as random as it actually sounds, wasn't completely random. But if I'm being honest with you, part of what was happening underneath was just pure exhaustion from my job. I wasn't necessarily looking for a dream of having a t-shirt shop. I was looking for relief. And those two things can look identical from the outside, but they actually lead you to very different decisions. So if you're sitting here with me right now, wondering whether it's time to change maybe specialties, the first question should not be, what do I choose? There's actually three better questions to ask first, and I want to walk you through each of them the way I'd walk through with a friend. Question one, what am I actually trying to get away from? This one takes a little bit of honesty, so just bear with me. A lot of times we say, I hate this job, I hate nursing. I've heard that so many times from people before when they're, especially after a really hard shift. What they're actually meaning is something much more specific. Maybe they hate the schedule. They hate being short-staffed every single shift. Maybe they hate their manager. Maybe they feel physically just like a train wreck after hour 6 into the shift of standing. Maybe they're hating carrying that emotional weight home night after night. These are very, very real things. They're not the same thing, though, as actually hating the profession. I spent most of my career in an ICU, in medical ICU, and honestly, I love critical care. It really challenged me in ways that nothing else did. It taught me to think fast and to stay calm when things were just going to hell, to trust myself in a room when it really mattered. I was a rapid response and code nurse, so I got pulled all over the place throughout the hospital to different codes and emergencies, even floated to different units. I was a resource nurse across like the whole hospital system, and some days that really stretched me, but I'm genuinely grateful for that experience. I also had seasons with that, though, where I was just completely burned out. I used to describe it to people, and in my body, I honestly felt perpetually hungover without like the fun. So to be clear, I wasn't drinking. It's just I felt that tired, physically tired, mentally tired, emotionally tired, spiritually tired in a way that never fully went away with like a good night's sleep. And when you live in that kind of exhaustion long enough, almost anything else, like creating a Etsy t-shirt store, just looks better. So when you make a big change, I want you to slow down for just a second. And I want you to ask yourself, honestly, what are you trying to leave? Like, what is the thing? Is it the specialty itself, or is it just the environment, or the workload, or the schedule, or the culture, or the leadership? Like, what is the thing that you're actually leaving? Because if you don't figure out what the core of that problem is, there's a very serious and real risk that you're going to carry that exact same thing right into your next role. Yes, you'll be on a different unit, but the deep same exhaustion for you is still going to exist. And I don't want that for you. I want your next move that you're thinking of to actually fix something. Question 2. What do you want more of? Ask yourself that, like, what do I want more of? Here's where I think it gets like a little bit more hopeful, because I don't want you to only think about what you're running from. I want you to think about what you're actually trying to intentionally build. When I decided to go back to school for my family nurse practitioner degree, it wasn't because I thought, ICU was beneath me. It wasn't, never regretted like working there. Yes, it was exhausting sometimes, but I just kind of reached a point where I felt like I really developed a level of expertise in critical care. And honestly, I wanted a new challenge. I wanted to learn something just totally different. I wanted doors to open. And honestly, I believed I was just capable of taking on more. That is a very different energy than just needing to move on and, get out of something, get out of the building. So ask yourself, what do you actually want more of? Do you want more autonomy? Do you want a more predictable schedule? Maybe you want more of a challenge. Do you want more patient education or more leadership abilities, more flexibility? Is family time important to you? Like, do you want more family time? Do you have do you want more emotional energy that's just left over at the end of the day for your family? Like, what are you building toward? And there's really no wrong answer here. Your answer is also allowed to change as you change in the season of life that you are in. What you wanted back in the day when you were a spunky 24-year-old is not necessarily what you want when you're 34. What you needed as a brand new graduate, fresh out of school, like new blood, is not necessarily what you need now. And you're allowed to outgrow things. And that doesn't mean that you failed at any area of nursing whatsoever. It means that you've just learned enough about yourself along the way that you want something different now. And that's actually like a really, really good sign. The third question I want you to ask yourself is, who do I want to become in the next chapter? Who do I want to become? Your next role that you're looking to step into isn't just a job. It shapes who you become professionally. Transitions, just in general, I've worked with so many people, are just a strange thing because they can make you feel brave and on top of the world and insecure at the same exact time. Like, you can be both excited and you could be both terrified. You could be just totally excited and energetic about something and completely humbled, all in the same shift. And, I have felt this in all transitions that I've made too. So I definitely relate to that very strongly. I graduated with my FNP program right as COVID was declared like a worldwide pandemic. So the transition in my head, all the planning that I had, I thought I was going to go from ICU to being a nurse practitioner right away. And it was a much different detour because of the life circumstance of COVID. It wasn't, what I got. I ended up taking on an educational role instead and became professor of nursing. And I actually had the opportunity to teach medical surgical nursing, advanced med surg, capstone development. I also picked up agency work at that time in a psychiatric institution, just all in the same window. Like, none of which of this was planned. None of this was like a neat, straight path I ever had vision for myself. But it really taught me something that I carry with me. And I actually think that this is why I understand this very deeply for people that I work with. Your career does not have to be moving in a straight line, okay? It doesn't oftentimes. You just have to be moving forward. Sometimes that detour that you didn't necessarily expect becomes part of your development overall. And I'll tell you that even now, in this exact coaching and education business that I'm currently building out, I feel like a beginner again. I'm having to learn all this technology I've never had to touch before, all these different systems and apps, and all amongst while like learning how to actually run a business, how to network and put myself out there in ways that honestly used to make me want to hide. And that brings up for me imposter syndrome. I have moments where I feel both super energized and excited, and then scared, and then energized, and then frustrated, and then confident, and then also, just totally uncertain, just all over again, sometimes in the same afternoon. And that is completely normal. And I want to say this as clearly as I can. Feeling like a beginner again does not mean that you are not where you're supposed to be. And it doesn't mean that you've made a wrong decision. A lot of time it means that you're just growing. You may be in that new environment, but you're not starting from zero. You bring so much background and judgment with you, with all your communication skills and your patient instincts and your resilience and your ability to learn hard things quickly, because you've already proven that to yourself more times than you probably give yourself credit for. You're just adding on to who you are. You're not erasing everything that came before it. A conversation, and where this video kind of, the inspiration that I had for this today is just based off a conversation I had when I was at work. And it really reminded me of just why this topic actually matters to me so much. I was talking to a nurse. She's a manager of a unit, and she is genuinely brilliant. She oversees a large unit, probably around 50 people or so, give or take, if I had to guess. She cares very deeply about her work. And at some point in our just random conversation today, I was actually giving orders. She was like, "Oh my goodness, I don't even know how you do this. I don't know how you'd become a nurse practitioner." And it just kind of opened up this whole conversation and dynamic. And she mentioned that she wanted to be a nurse practitioner, but she's like, "Oh, but I can never do that. And, that's not for me." And I'm like, "Why not?" And as soon as I asked this question, she didn't have to say anything. I actually just seen like the doubt show right up on her face. And she actually literally said, "I don't know if I'm capable of doing all of that." And I remember thinking to myself, like, what do you mean? You manage like 50 people. You lead a unit. I think there's like 70 patients. You solve real problems with real people every day under pressure, and you do it so well. You do really hard things. And I said this to her. I think sometimes we just need somebody else to hand us, back our own evidence, because self-doubt can be so loud that it drowns out everything else that we actually know to be true about ourselves. We, in this conversation talked through like school and costs and just what the path realistically looks like. And at the end of the conversation, I think she genuinely is like considering putting herself out there with bravery and applying. And it's not because I pushed necessarily into her, but maybe for the first time in a while, she really gave herself permission to believe that she might actually be capable. And I think that is what a lot of nurses need. Not somebody pushing them toward a decision, but somebody to help them to stop talking themselves out of one. So I want this to just sit with you for a second. And I actually would like for you to even pause this and get a piece of paper and write it down, just the 3 questions again that I want you to reflect on before making a transition. So like, again, what am I trying to get away from? Like really, truly. What do I want more of? And who do I want to become in this next chapter of my career? I want you to be honest. Maybe you don't realize you actually, maybe you don't need to leave it all, like where you're at. Maybe you just need like a different scene, different environment. Maybe you realize that you genuinely do want a totally different specialty. Maybe you've been thinking about going back to school for 5 years and keep talking yourself out of it. Or maybe you land on, I don't know, and that's okay too. You don't necessarily need an immediate answer today. You just need a clearer one than one you're carrying right now. And this is where I do want to genuinely challenge you And, not in really a pushy way or anything, but just as someone who generally wants to see you stop holding yourself back, at some point, you have to stop letting uncertainty be the reason you stay frozen. You don't need to know everything before you take the next step. You don't need to feel 100% confident. And truthfully, you probably will never feel 100% confident. You don't need the entire pathway mapped out from here to there is like a finish line. Sometimes, like a brave step could just even look like researching the thing that you're thinking about, or maybe networking and talking to somebody already in that specialty, or maybe that's reaching out to a manager and shadowing someplace for a shift, or maybe it's updating that resume that's just sitting somewhere in your hard drive for years and years and years. Maybe it is hitting the submit button that you have been sitting on in that application that you filled out. Confidence does not, confidence does show up after you move, okay? Not before it. I actually built a really nice specialty guide for you guys if you are interested at all. And it helps you with decisions. It's more than just like scrolling like job boards like I did, or thinking of making a t-shirt shop after a difficult shift. It is really like specialized with backed in research for registered nurses and NPs in different pathways to really like think through intentionally like what your next chapter could look like. It walks you through reflective prompts to help you decide like why are you leaving? What do you actually want more of? And what might actually genuinely fit you? And that, if that sounds like something that would be helpful, I've linked it below this video, like no pressure at all. Even if you've never touched, the guide and that's not something for you, I want you to keep the 3 questions I gave with you. Again, what am I trying to get away from? What do I want more of? Who do I want to become? And then be brave enough to actually reflect and sit with your answers. You don't have to have your whole career figured out today. You just need to stop letting that scared version of yourself make every single decision, and know that you're allowed to change and you're allowed to grow and you're allowed to feel like a beginner again. Thank you.